Thanks very much. It's a pleasure to be here. I didn't put together very much in terms of prepared remarks. I thought I would just say a few words about what we're doing and hope that we can have a robust discussion. Seems like it's an intimate enough group that we can, that might be the better way to proceed. I'm a professor of medicine at the Yale School of Medicine, and several years ago we started to work towards in efforts to see whether or not we could promote greater data transparency and data sharing. I think it started with the notion more of transparency and ended up more in sharing. Do people know what we're doing with the YODA project, so we don't have to, you guys I think have heard about it and other things. Let me just say that, you know, the principles that we're trying to do is we're trying to put together a project that fundamentally promotes data sharing, promotes responsible conduct of science, and protects the rights of the subjects who were involved in the effort. You guys have talked ad nauseum about the benefits of data sharing. We sort of had this notion early on that you can litigate it, you can regulate it, or you could cooperate and collaborate around it. And very early on, we wondered whether or not it was going to be possible to find ways to create relationships and trust with organizations that own data, and particularly focusing on industry, that would allow us to share. And central to the model that we put together was that we could serve as a trusted intermediary. There may come a time where that's not necessary, but given the polarization of opinions and the suspicions that exist all the way around, there was a concern, I think, that that delays that might be put in place as companies move forward on this were for purposes other than full transparency and data sharing, and that by having a partner that was independent and committed to the idea of data sharing could be very useful for a company. When we first started working with Medtronic, it was around a particular product. They were facing a particular challenge, and we were able to come to an agreement whereby we could serve as a way for them to get a truly independent assessment of their data and then share their data subsequently and tamp down some of the surrounding noise and focus specifically on the idea of what would make for the very best science, trying to avoid the politics and legal issues that were surrounding that particular issue. I will say that before we were able to broker that deal with Medtronic, and I give Rick Kuntz, who I know was here earlier, a ton of credit for navigating that through the company, people would regularly tell us that it would be impossible to get into a situation whereby a publicly traded company would be willing to share their data assets and do so in a way that they transferred the jurisdiction and authority over that data to an independent academic group to distribute, which is what Medtronic did. Once we did this with Medtronic, we were told that you'll never find a number two. You know, we're kind of persistent and tend to think that maybe there is a way to do things. And again, we really didn't want to put this in place where it had to be litigated or regulated. And we think that it is in the best interest of data owners to share their data openly. You guys have heard this, you know, many times. And ultimately, Johnson & Johnson, starting with their Janssen group under the leadership of Joanne Waldstreicher, stepped forward. You know, this again evolved over a series of conversations and discussions about how this might go. There are two facets to this. One is our attentiveness to the interests of the stakeholders and data owners. We want to respect and honor their contributions and their issues. But it also came with a non-negotiable piece whereby they would completely transfer all authority and jurisdiction over decisions regarding the release of their data to us, and that would be contractually mandated. And in order to get to that point, requires that the organizations develop a common understanding about what they're trying to accomplish together and develop the trust to be able to execute this in a way that's going to serve society's best interest, but recognizes that we're not trying to create a one-off, but instead a sustainable model whereby it would be good for society, it's good for investigators, it's good for patients, and it's good for the data owners, in this case, the company. And that means, and all of that has to take place, in our opinion, in public view, so that there's no concern, because ultimately they are at this point in time needing to fund this effort. So thereby they're funding us. We're the independent academic unit, but we're being paid by Johnson & Johnson to do this work. So we have to protect our reputations and ensure that there's full knowledge of everything that we're doing with regard to the data release. And I'm here to tell you that that this is a lot more complicated than it seems on the surface. That in the course of trying to figure out how best to do this, we've encountered a lot of speed bumps. And again, trying to promote the data sharing, the best possible interests of science, and protect the patients, there are a lot of issues along the way about how best to do this. And we also want to leverage off of existing resources like clinicaltrials.gov and incorporate within this the guarantee that all the trials that we're talking about will be registered and reported. So all of these things put in place when you've got an independent academic group, I think it has a different flavor to it than if a company was saying, sorry, this is taking us so long. Sorry that we're running into these roadblocks. We're trying to learn from it, to spread generalizable knowledge from it, and to be completely clear about what it is that's challenging with regard to this. We're learning the company doesn't always have all authority itself over all the data. Through their own partnerships, there are challenges. The informed consents may sometimes present challenges. We're asking the question, does anyone have a right to request any data, regardless how trivial their question may be, when the costs of making that data available may be considerable? How do we as an independent mediator sort of handle a situation like that, where we're not trying to keep data private, but on the other hand, we need to be cognizant of the costs involved and what efforts need to be put into place. So anyway, I think this can make for a ripe discussion, but I just want to say that we've been working hard with a very expert steering committee led by Zeke Emanuel and individuals like Jim Neaton and Dennis Thompson and Deb Zarin and Rita Redberg and others who have guided us with great wisdom around these issues, as well as we are actively cooperating with the company and with any company who wants to make suggestions. And tomorrow we anticipate being able to post for public comment our next set of guidance documents, policies, and procedures by which we hope within the next several months will be in place, accepted, and will guide our release of the Johnson & Johnson data, starting with Janssen pharmaceutical data. They've made a commitment that they're going to go through their devices and even their consumer products in the course of this effort. And I just will say that we consider this to be a learning project, so it will likely be iterative. We want to learn about what works and what doesn't work, how much does it cost, what are the most efficient and effective ways to make this work. We're not trying to, by the way, build a business for ourselves. We're just as happy for others to enter into this kind of relationship and take advantage of everything that we're doing. And then we will be revisiting this on a regular basis to try to update and clarify this and to improve it. But that's where we stand tomorrow. We'll be posting for public comment probably for 2 or 3 weeks. We sort of aimed for 2 weeks of public comment, then come back in and try to come up with the initial policies that will guide the initial release of availability and release of these data. Thank you.
Thank you. Dr. Boren?